So this is the right hand. Now we're gonna do the thumb on the right hand. So the thumb naturally is like 45 degrees away from the other ones. You center at this joint. I can kind of collimate right there. So this right here is actually the oblique. This is not the AP or PA, whatever. So this is oblique. So I always do the oblique first since that's the most natural way to do it. For the lateral, all you have to do is kind of, so you see, if you can see, the nail bed is slightly angled. So you want to tilt your finger so that it's totally like perpendicular to the board. And then you can put your fingers down to stabilize it. And that would be the lateral thumb. Then there's two ways to do the other one. So what I always try to do, because it helps to decrease the OID, is I do it this way. And what I can do is lower, what helps is lowering this. That helps it not feel so uncomfortable for the patient. You try your best to kind of make sure that this part of the hand is not going to be in the way. No shadow, if possible. Slightly tilted, so we're just going to rotate it just a little bit like that. And then I can collimate just a little bit more. So that would be the thumb from the palm side. If the patient is not able to do that, what you can do, this one's more easy, and a lot of times it has, like, it's the super injured patients or people who have like arthritis or something and they can't move very well. You can do it like this. It gives you the exact same thing. Just make sure that the thumb is like nice and straight, and nice and, you know, parallel. So this one is more comfortable for the patient, but this gives it way more OID, which means that there's more magnification and makes the image a little bit more blurry. You know, it's kind of like that. So I always just try to do the first one, and if they can't do it, I'll do it like this. So this is the right index finger. You center right there. And then for the oblique, you just kind of, I always put like 2 fingers. And then just try to center it again. And that would be the oblique. And then for the lateral, you would stick your finger out and then turn it over on its side. With fingers, the most important thing is to make sure that it's straight. So, so it's not rotated. And you want to try to get the other fingers out of the way as best as you can. The way that you can tell if it's not rotated, you kind of look at the nails. If it's like nice and, I guess it would be perpendicular to the board, then that would be nice and straight. So that would be the lateral of the index finger. So then for the middle finger, just a PA, basically kind of centering the same thing. So it would be like that. And then for the oblique, you do the same kind of thing. I always put like 2 fingers, and that's usually a good angle. And then you just want to kind of make sure that the fingers are separated and that the shadow is not there. And then you want to make sure that everything is parallel to the board. And then for the lateral, you try to just stick out your finger, and you can either do it like this, usually this way is easier, or you can do it like this, because it'll get you closer to the board, so like it would sort of give you a better image. But if it's more uncomfortable, then you do whatever is more comfortable for the patient. For the ring finger, so you just center it kind of there again, make sure that the other ones are separated. And then you would angle again, that way, kind of like 2 fingers. Make sure that these fingers are separated. And then it's always really difficult trying to do the ring finger lateral because you kind of have a hard time separating it. So what I usually do is fan it out. So let's see here. So just make sure that the hand is still on its side so that it'll be a true lateral. You kind of center it on that joint. There we go. And then just try to make, sometimes you'll have to kind of tilt so that it's collimated the long way, basically. You just want to try to, sometimes you'll have to follow the finger, basically. And then that should be a good lateral, as long as it's parallel, which it is. For the pinky, we'll just start off with the PA. We'll go back to how it was, nice and straight. Stuck, there we go. So now, so it's nice and in the center. So that would be the PA. And then the oblique, this one's kind of like really easy because what you can do is put these fingers down and it kind of helps to stabilize everything so that the patient's not shaking. So you'd kind of do it like that. And then the lateral, yeah, basically, there we go. Center it right there, make sure it's nice and straight, and then it's like that.